Welcome back to What's in Your Head, Tools for Pain and Dizziness. I'm Pete Schultz, Doctor of Physical Therapy. Today we're talking about fibromyalgia, a condition that's very real, very common, and often misunderstood. Many people living with fibromyalgia experience widespread pain, fatigue, poor sleep, brain fog, headache, dizziness, and increased sensitivity to stress, movement, touch, or sensory input. And for many people, they've spent years searching for answers while being told nothing is wrong. In this episode, we'll break down the current research says about fibromyalgia, why it's considered a clinical diagnosis, and how modern treatment has shifted away from searching for one damaged tissue and towards understanding the nervous system, pain processing, movement, stress physiology, sleep, and recovery. We'll discuss the role of physical therapy, exercise, pain neuroscience education, mindfulness, biofeedback, graded exposure, and pain reprocessing therapy. The goal isn't to convince someone that the pain is all in your head. The goal is to understand how the brain and nervous system can become overly protective and sensitive, and how we could help calm that system back down over time. As always, this podcast is for educational purposes only and is not intended as medical advice or a substitute for individualized care. If you're dealing with persistent pain, dizziness, headaches, or fibromyalgia symptoms, make sure you speak with your physician or a qualified healthcare provider. Let's get started. Fibromyalgia is one of the most common and misunderstood chronic pain conditions. Many patients have normal imaging and blood work, yet experience really severe symptoms. The symptoms are real, and they could significantly affect your quality of life. Common symptoms in fibromyalgia include widespread pain, fatigue, poor sleep, cognitive dysfunction or brain fog, headache, dizziness, exercise intolerance, increased sensitivity to sensory input. What is fibromyalgia? Fibromyalgia is a chronic, widespread pain condition involving a sensitized nervous system and altered pain processing, and it's often associated with fatigue, sleep problems, cognitive symptoms, headache, dizziness, and increased nervous system sensitivity. Literature now increasingly classifies fibromyalgia as a neuroplastic pain condition. It's a sensitized nervous system. And the International Association for the Study of Pain defines nocioplastic pain as pain that arises from the altered nociception despite no clear evidence of actual or threatened tissue damage causing activation of peripheral nociceptors. This does not mean that you're imagining symptoms. The symptoms are real and the pain is always real, but these symptoms are due to a sensitized nervous system and the way that your nervous system processes pain. Fibromyalgia is associated with altered pain processing in the nervous system. Central sensitization, which is over time your nervous system becomes increasingly sensitive to any stimuli. Amplified sensory processing, autonomic nervous system dysregulation, impaired recovery, and restorative symptoms. It's not inflammation, it's not only structural, and it's not psychological. Fibromyalgia has been a challenging diagnosis to come in, especially for physical therapists to treat, but now we're understanding it a little bit more because we understand how the pain is processed in the nervous system. Many of these patients are going to have normal imaging, normal lab testing, despite experiencing these really amplified symptoms. And I can't stress this enough, is that the pain you're experiencing is real. No one's making up this pain. The pain is real, but it's a problem with sensory processing in the nervous system. How is fibromyalgia diagnosed? The most commonly used diagnostic framework is from the American College of Rheumatology criteria, and fibromyalgia can be diagnosed when these three conditions are met. The first condition is that you need to have widespread pain, and there's something called the widespread pain index. And if the widespread pain index questionnaire is greater than 7, that's one of the criteria. Also, there's something called the symptom severity score, and if that's greater than 5. So the widespread pain index is greater than 7, and the symptom severity score is greater than 5. That is one of the criteria that we use to diagnose fibromyalgia. The next criteria is pain must be present in at least 4 or 5 body regions. It has to be widespread pain. You have to have widespread pain. And the symptoms must be present for at least 3 months. This diagnosis is based on symptom patterns, not blood tests or MRI. Patients may also have arthritis, migraine, disc problems, Ehlers-Danlos, autoimmune disease, vestibular disorders. We used to diagnose fibromyalgia with trigger point testing or tender point testing, where there were these 18 sites of trigger points, and when you would push on the spots, if 11 out of the 18 were positive, then that would be a positive diagnosis of fibromyalgia. But that's outdated, and we don't really use that system anymore, because that was more of a structural-based diagnosis. Now, fibromyalgia, like I said before, is a clinical diagnosis. Your doctor is going to have to evaluate it based on what you're reporting and the things you're saying and what you're experiencing to come up with this diagnosis. To understand how the pain with fibromyalgia works, we have to understand the nervous system, or how the nervous system processes pain. For example, when you step on a nail, you have sensors, nociceptors, that are sensors in the fascia of your foot. Some of these nociceptors are sensitive to sharp, dull, hot, cold, pressure, tension, vibration. These sensors in the fascia and in the skin get stimulated when you step on a nail or step on a piece of glass. And that sends a signal to the spinal cord, which sends a signal to the brain. And then when it gets to the brain, the cerebral cortex has to figure out if this situation is safe or dangerous. And it does that through predictive processing and understanding past experiences. Past experiences like, what do we know about nails? What do we know about feet? What do we know about this time of year? What do we know about this season? What do we know about the place that we're at? Then it goes to the prefrontal cortex, and the prefrontal cortex has to determine if you're having a safe situation or a dangerous situation. And if there's more credible evidence of danger than there is credible evidence of safety, the nervous system will create pain in the foot, in this particular example, to protect you. Pain is a protective mechanism from your nervous system when the nervous system senses danger. So it's a prediction based on feeling like you've done something that is dangerous to you. Pain is a protective mechanism. Pain equals protection, and pain does not equal tissue damage. Now, sensitization of the nervous system is when, if you've had pain for over 3 months or 6 months or 3 years, your nervous system gets used to protecting. And the more the nervous system will protect you, the easier, the less it takes to stimulate that. Basically, the longer you have pain, the more the nervous system is practicing, and the nervous system thinks it's doing a really good job protecting you. That's why it's easier to stimulate pain. And when you have these chronic pain conditions, they're harder to get rid of because the nervous system is a little more sensitive and the pain system is more sensitive. And that's what we call central sensitization. But we're also having an amplification. We know that fibromyalgia is this amplification of normal sensory input, and it's really an inaccurate pain mechanism. The pain mechanism and the processing is a little more sensitive, and the nervous system is being protective, and it doesn't really have to be. So it's a little overprotective. Now, things that could contribute to this overprotection is poor sleep habits, increased stress in your life, inactivity or lying around too much, overactivity, doing too much, fear of movement, fear of doing anything that's going to hurt you, catastrophic thinking, and repeated pain experiences. All these things could increase nervous system sensitivity and increase the nervous system's thoughts of danger. Pain neuroscience education is understanding the nervous system, and the purpose of it is to reduce fear, improve understanding, because the more you know about how pain works, the less pain you experience. Also, it helps improving self-efficacy and improving confidence with movement. How is this treated? We treat fibromyalgia through a multifaceted treatment approach. There's a few different things that we want to focus on to treat fibromyalgia, and this is the best way to tackle this chronic pain condition or fibromyalgia. The first thing is traditional physical therapy. So physical therapy and exercise. And the goals of physical therapy and exercise would be to improve movement tolerance, to increase mobility, get your joints moving better, increase blood flow to the tissues, increase muscle strength, increase aerobic capacity, improve your confidence with movement, and reduce pain flares. The strongest evidence among non-pharmacological interventions supports exercise, aerobic exercise, strength training. All these things are going to help with reducing your pain flares and reducing the amount of pain you're in due to fibromyalgia. Some of these exercises could include walking, progressive strengthening, swimming, cycling, mobility work, and pacing strategies. We want to avoid pushing through severe symptoms because pushing through severe symptoms can cause more frequent flare-ups. That's why exercise, it's important to monitor and pace your exercise. You don't push too much. You don't do too much too fast. Take it easy. Even if you could lift 100 pounds, only lift 60 pounds. You don't have to do your maximal effort. You could kind of pace it. The next part of the treatment would be pain neuroscience education. Pain neuroscience education is really helping people understand what's happening, reframing negative thoughts and emotions, reducing catastrophic thinking, reducing fear of movement, and better understanding the relationship between tissues and nervous system, stress, sleep, and pain. Well, pain neuroscience education is what we just talked about with the stepping on the nail. People who understand what pain is and how the pain system works will tend to experience less pain. Physical therapists or healthcare providers will often educate people on pain to try to reduce their pain. And education is most effective when combined with movement, therapy, and behavioral strategies. The next treatment strategy is self-regulation and biofeedback. Biofeedback is using technology to measure heart rate, muscular tension, hand temperature, sweat on your hands, to see if we're in survival mode and to see what helps us get out of it. With self-regulation and biofeedback, we're looking at heart rate variability. Heart rate variability is a measure of the nervous system. There's different biofeedback systems like HeartMath and Thought Technology, a couple of different systems where we could actually see through heart rate and heart rate measurements if you're in fight or flight, or if you're in the sympathetic branch of your autonomic nervous system. And we could also see what tools and what breathing exercises get you out of it. We could do paced breathing, which might be like a 4 seconds in, 6 second out. Or we could do box breathing, 4 seconds in, 4 second hold, 4 second out, 4 second hold. Or we could do 4-7-8 breathing. There's different ways to pace your breathing. And using technology through biofeedback, we could see which works the best. Also, we could do visualization, affirmations, thermal biofeedback, which is measuring the temperature of your finger. And as your hands get warmer, that means you're in a more relaxed state. If your hands get colder, that means you're more in a stress state. We could do EMG biofeedback, which is we could measure muscular tension. And if you're stressed or you're in this fight or flight state, your muscles are going to be a little more tense. And if you're in a relaxed state, the muscles will be a little bit more relaxed. The goals of self-regulation and biofeedback were really to reduce sympathetic fight or flight activation, to improve autonomic regulation, to decrease physiologic arousal, and improve body awareness and improve self-regulation, and to show that you have control over your nervous system. Now, a lot of things that could also help is your sleep habits or some other symptoms besides pain, like dizziness, headache, fatigue, and chronic stress. The next treatment approach for fibromyalgia will be mindfulness tools and behavioral strategies. So there's a lot of strong evidence that supports things like cognitive behavioral therapy or acceptance and commitment therapy or mindfulness-based stress reduction, any of these mindfulness-based interventions. And these approaches improve coping, disability, emotional distress, symptoms management, and fear avoidance behaviors. These could be really good for managing your symptoms. And again, not one of these approaches work well in isolation. It's this multifaceted approach of all these things together. Behavioral therapies do not imply that symptoms are imaginary. They target the nervous system regulation, stress response, fear, attention, behavior, and simplification. Basically, this isn't saying that these symptoms are made up or in your head, but you're working on the strategies to improve them. Another approach is pain reprocessing therapy. Pain reprocessing therapy and somatic tracking. There's some really strong evidence with pain reprocessing therapy and lower back pain, chronic lower back pain, and there's new evidence emerging about fibromyalgia and these other chronic pain conditions. So what pain reprocessing therapy does, it tries to reduce fear, increase safety, makes you pay attention to your symptoms and be curious about them instead of being scared and trying to reduce hypervigilance. Pain reprocessing therapy has really strong evidence with chronic back pain, and there is emerging evidence on fibromyalgia and other nocioplastic conditions. Somatic tracking, which is the main tool with pain reprocessing therapy, involves observing sensations without fear, reducing catastrophic interpretation of signals, decreasing protective nervous system responses, and developing greater feelings of safety around your body sensations so that your nervous system is less protective and you have less pain. The next strategy is graded exposure. Graded exposure has to do with pacing. Do the activities that you're afraid to do, gradually returning to fear or avoided activities. With fibromyalgia, you might be afraid to go to the gym, or you might be afraid to lift things heavy, or afraid to put your suitcase in the overhead bin. These are all things that we want to try to encourage people to do at a graded, paced level. These are things like walking, exercise, lifting objects, driving, social activities, stair climbing, and then going to busy environments, because often people with fibromyalgia feel this overwhelmed sensation and they don't like being in busy environments. The goals of graded exposure are to reduce fear avoidance, improve function, and retrain the nervous system that movement could actually be safe again. And we're going to emphasize gradual progression and consistency over intensity. Wrapping this up, fibromyalgia is a real condition. The diagnosis is clinical. It's a clinical diagnosis, which means that there's no MRI, X-rays, imaging to determine if you have it. It's more a clinical-based diagnosis based on the patient's reports. The symptoms involve nervous system sensitization, altered sensory processing in your nervous system, and it affects multiple systems. The imaging is often normal, and the blood work is often normal, but the pain is real, and it is uncomfortable, it's debilitating, and the symptoms and the pain are real and they are painful. The treatment works best when combining movement, education, pacing, autonomic nervous system regulation, mindfulness, behavioral strategies, and graded exposure. And recovery is often gradual and nonlinear. There may be some ups and downs, and you have to really watch and pace throughout your recovery. But the best approach is a multifaceted approach which involves traditional physical therapy and exercise, mindfulness, biofeedback, aerobic exercise, and it's a multifaceted approach. It's not just pain education, not just one thing is going to get you better. Thanks again for listening to the What's in Your Head podcast, Tools for Pain and Dizziness. Fibromyalgia can be increasingly frustrating because symptoms are often invisible, unpredictable, and multifactorial. But the good news is that we now have much better evidence showing the nervous system is adaptable and that many people improve through a comprehensive approach that combines education, movement, sleep optimization, nervous system regulation, stress management, graded activity, and individualized rehabilitation programs. Recovery usually isn't about finding one perfect treatment. It's about gradually creating more evidence of safety for the nervous system and helping the body become less sensitive and more resilient over time. If you found this episode helpful, please consider sharing it with a friend or leaving a 5-star review on Apple Podcasts or Spotify. It really helps more people find the show. And if you want a physical therapy evaluation, concussion care, dizziness treatment, headache management, vestibular therapy, pain reprocessing therapy, you could visit dynamicsportspt.com to set up an appointment. And if you want more information and education on pain, you could find that at painanddizzy.com. Thanks for listening, and we will see you next time.